And now I give the floor to Mr. Michel Perron, Chair, VNGOC Committee on Drugs.
Chairman, distinguished delegates and colleagues, I take the floor on behalf of the Vienna NGO Committee on Drugs. My full statement is available at vngoc.org. Our members come from a wide range of international and national NGOs who provide a vast range of services to prevent substance misuse, provide treatment, care and recovery services, champion sustainable development, and contribute this expertise to drug policy work. The basis of our intervention today is drawn from our global consensus document entitled Beyond 2008, which informed the 2009 Political Declaration and Plan of Action. We wish to make three specific recommendations. First, the future direction of drug policy is being openly debated. Rampant violence, corruption, and a significant loss of life are pointed to as consequences of the current policy. In addition, human rights, along with sustainable social and economic development, are being undermined. While many NGOs have very specific and often opposing views on the solution to the problem, we all strongly recommend the following: that any actions planned for or undertaken by member states be evidence-based, supported by scientific data, and evaluated for results, including analysis of any unintended consequences. Second, drug dependence is a health matter. There is a documented relationship between a public health approach to drugs and the improved health outcomes of drug users, their families, and the communities in which they live. Further, the protection of children from illicit drug use is clearly referenced in the United Nations Convention on the Rights of the Child. Simply put, we know that evidence-based prevention, treatment, abstinence-based recovery, and other programs work. As such, we strongly recommend that member states ensure that demand reduction activities be considered as equally important to and as required as supply reduction activities, and that alternative sanctions and dispositions for drug-related crimes be made available as permitted for under the conventions. Third, the stewardship of global drug policy and development is a shared responsibility, and NGOs have clearly agreed to fulfill that part of the partnership. Equally compelling are the tremendous financial and in-kind assets that NGOs possess. As the global community is faced with one financial crisis after another, it is clear that closer cooperation with NGOs is a cost-effective measure for all. As such, we recommend that member states establish and support mechanisms for partnerships with NGOs in order to develop innovative new strategies to reduce illicit drug use and the harms associated with drugs. Mr. Chairman, in conclusion, there is no shortage of knowing the problem and how best to resolve it. Over the past decade, several proposals have been launched to make the drug control framework more fit for purpose. An open discussion about alternative policy options is essential, as is committed action on already agreed to plans of action. In closing, the VNGOC calls upon this body to ensure that each of the ECOSOC functional commissions, and especially the Commission on Narcotic Drugs, honors the spirit and intent of the UN's stated commitment to working with NGOs, and that the UNODC be equipped with the necessary resources to follow through on these recommendations as soon as possible, with NGOs and member states included. Thank you.
I thank you, Mr. Perron, for your statement.